Good afternoon. Welcome to the White House, and welcome to the White House Affordable Care Act Champions of Change program. My name is Karen Richardson, and I'm an Associate Director for Healthcare Outreach in the White House Office of Public Engagement. Today, we are honoring 10 lovely individuals who are making a difference in their communities by helping others understand the impact and benefits available to them under the health reform law, the Affordable Care Act. We have a great program lined up for you today where you will hear from all 10 champions about the work they are doing in their communities and from administration speakers who are working on implementing the law and educating communities about the benefits of the law. So without further delay, I introduce to you our first speaker, who is John Carson, the Director of the Office of Public Engagement. Thank you.
Thank you, Karen, and good afternoon, everyone. Welcome to the White House. Welcome to everyone who's following us along online today. And let's give a big round of congratulations, first of many, to our champions.
Congratulations.
I just wanted to kick things off by briefly telling you a little bit about the Champions of Change program. And then I have an ask for our champions, for our wonderful audience today, and for everyone who's following along online. We created the Champions of Change program here in the White House for two reasons. First, this president and this administration knows that we here in Washington do not have a monopoly on good ideas. There are amazing individuals all around the country who are making change happen. And while we here in Washington sometimes get bogged down in debates, get bogged down in fights, we here never forget for one moment that all across this country there are millions of Americans taking charge, making a difference in their community, just like the champions that we have here on stage today. So we like to take this spotlight power that we have and put a spotlight on these amazing stories. The ask that I have for all of you, whether you're following online, whether you're here today, or especially for our champions, is to tell your story, to tell the story of the organization that you're working with. I know so many here in the audience are working to make sure your community, your networks, individuals across your state know about and are benefiting from the Affordable Care Act. Tell the story of your involvement. If you're online and you're following, tell the story of what you're doing. But especially to our champions, we've often noticed sometimes the community leaders like yourselves are actually the most hesitant to tell your story and talk about the change you've been able to make. But I ask you to do it for two reasons. First, especially on an issue like this, making sure people know about and are benefiting from the Affordable Care Act, the information you have to share quite literally is saving lives. But I also ask you to tell your story of involvement because we need more Americans just involved in civic participation across the board. And when they hear your story as a champion, when they hear your story of the organizations you're working with, they'll start to ask, well, maybe I could do that as well. And you will inspire others. We've seen this with our other Champions of Change programs. You'll inspire others to action. So that's my ask of each and every one of you today. Write about it, tweet about it. If you want to tweet me, I'm at JohnCarson44. Pull 3 people aside in the grocery store tomorrow when you see them. And I'm very excited to introduce our first speaker here today, because one thing I want you to know, as there are tens of thousands of individuals, hundreds of organizations across this country working on the implementation and the promotion and the just explanation of the Affordable Care Act, I want you to know that this president and his entire administration are committed to defending this law and making sure that it is implemented in the absolute best possible way. And of everyone involved in that, we have here today the leader of that effort, the woman who is taking decades of experience in this field and her knowledge as a governor and a cabinet secretary, leading the team that is going to make the Affordable Care Act implemented as one of the best laws we've ever seen. I'd like to introduce the Secretary of HHS, Kathleen Sebelius.
I should be providing the applause for all of you, and certainly for our 10 health champions. I'm delighted to have a chance to be with all of you today, and I want to recognize a couple of people who are in the audience, but first to thank John Carson for his leadership and his effective strategies in the Office of Public Engagement. So thank you, John. Let's give him a round of applause. A couple of our great health leaders and outreach leaders are here. Dr. Mary Wakefield, who you'll hear from in a little bit on the first panel, is with us today. Ann Widger, who is head of our public outreach office, is here. And I know somebody who worked on this bill tirelessly as we were trying to navigate the thorny halls of Congress. Becky Patchen is also with us. Becky, at that point, was the president of the AMA and was a great champion, so thank you. I want to really start by thanking all of you for what you do every day to improve health in all of your communities. I think all of you share the passion that this administration shares, which is that health is the foundation of opportunity across America. It's the prerequisite to have people be able to pursue their own dreams. And for years, you and other community leaders in cities and towns across the country have done absolutely heroic work to help plug the holes in what was and continues to be in too many places a very broken system, but helping figure out ways and strategies to help Americans get the care they really need. And you're here today because you recognize that we couldn't give every American the health security they deserve without closing those gaps for good and without creating a whole new system. And that's why you rolled up your sleeves and helped us pass the Affordable Care Act. Now, I know you already see how this law is making a difference in your own communities. And I get to see it every day as I travel around the country. I've been in living rooms and been recently with a mom who had a 2-year-old diagnosed with leukemia and heard her talk about the difference it makes to not only know that the law won't allow her daughter any longer to be locked out of the health insurance market, but know that her daughter, as she grows up, will have the opportunity to have affordable care in the future. I've had strangers come up to me in airports and say, my son was born with a pre-existing health condition. And now I have some peace of mind. I know that he will eventually be able to be covered, and I never was certain about that before. Just 2 days ago, I was in St. Louis, where I met Fritzi Lanehoff. Now, Fritzi is a senior who has some serious health challenges. She's a cancer survivor and has some other issues. Her husband also has health challenges. And she has so far saved about $2,500 on her prescription drugs, thanks to the beginning of the closing of the donut hole. Now, to Fritzi, that's real serious money in her pocket. She said, we can go to a movie again. We can think about going out and meeting our friends for dinner. We were really in a desperate shape and didn't know how we were going to handle paying for our medications going forward. And she's just one of 5 million seniors who have already saved an average of $635 each, real money in their pockets this year, thanks to the Affordable Care Act. So I get to hear from lots of people who represent the millions of Americans already benefiting from the law. But what I know is it couldn't have happened without you, and it couldn't have happened without you, the health champions here on the stage with me today. I know how frustrating it is because, again, it happens to me every day. When you meet people who either are full of misinformation or who have no idea that there was even a bill passed, don't have any idea how it can help them. Now, I have to tell you the reality is that there are many good reasons for it. One of the things that I don't think any of us can forget about is that opponents of the law spent a lot of time in the year and a half of debate before the law was passed, and a lot of time since then, 2 years, spreading information that just isn't accurate and using a lot of money to spread that information. So there has been a lot of factual errors, a lot of conversation that just isn't true. And part of it is why a lot of people continue to be confused by the debate. But what we know is that the most effective strategy, the most important work that can be done to counter that misinformation, that's been incredibly important and effective is to hear from real people who have seen benefits, or to hear from trusted community leaders or friends and neighbors. Frankly, when I talk to folks, they see me as a government official, and they figure I'm as much a spin as maybe somebody else who's spinning the law the other way. But when they hear from trusted friends and neighbors, their own healthcare providers, their community leaders, their outreach, that really makes a difference. And certainly when they hear from individuals who tell a story about what's happened to them. Very powerful, very meaningful, but again, we can't do that without your help. So this year is the second anniversary of the law being signed, and next week the Supreme Court begins their deliberations on the law. So the coming weeks and months may be some of the most important that we've had in this entire debate since the bill was signed on March 23rd, 2010. It's an especially critical time to do outreach, to first of all convince people that there is a law in place. I have a number of people who say to me, well, since the law was found unconstitutional, I guess it's all over. And I have to remind them, no, a court challenge is not mean that the law is unconstitutional. There will be a discussion. And in fact, more courts have found it constitutional than not heading to the Supreme Court. But I don't think any of us should assume that that translates very easily into the public. A lot of people say, well, if the House of Representatives voted to repeal the bill, it must be repealed. And again, a little civics lesson, no, it has to go through the Senate and then would have to be signed by the president. So the law is very much in place, and it's being implemented across the country. It makes sure that people have the information they need to take care of themselves and their families. And I know that unfortunately still there are women who have felt a lump in their breast who's putting off a mammogram because they're not sure if they have the copay or can afford the deductible. There's a senior who's still going without prescriptions, thinking they're going to have to skip their meds because they don't know that automatically the donut hole deduction will be applied to their prescription drugs. Their parents with kids with a heart defect who don't know that calling their insurance company can make a simple solution, because now it is illegal for those companies to lock their sons and daughters out of an insurance plan. So first I want to tell you that the 10 people on the stage today are chosen because they have been true health champions. And they were not the only 10 people, by the way, who came our way. I know a number of you have helped nominate these health champions, but there were hundreds of people nominated. They were chosen because they have gone above and beyond, have done extraordinary work in filling some of the gaps that people find every day, and they are doing this work across the country. So I want to, first of all, congratulate you for being health champions, to thank you for what you have been doing, but to tell you, roll up your sleeves, because we have some very important work left to do. I want to thank you for service to your communities, and I want to tell you, as you're continuing your effort on the ground, we are with you every step of the way, and you are making a huge difference. I get a lot of thank yous for the work you're doing, and I'm grateful for that. And for the almost 300 million Americans who aren't in the room with us today, I want to say thank you on their behalf, because they are the true beneficiaries. I want to now turn the podium over to Mary Wakefield. Mary is going to be moderating the first panel. Aside from being the head of one of our key agencies, the Health Resources and Services Administration, which runs the healthcare workforce operation, runs the Ryan White program, is in charge of community health centers, aside from a few other things. Mary is also our highest ranking nurse in the administration, and as you know, yes, that is a huge round of applause. I must say, and all due deference to the doctors in the room, we were thrilled to have doctors with us with the passage of the Affordable Care Act, but nurses have been after this for 70 years and knew that health reform was a high agenda item. Mary has a huge voice of rural health care, hails from North Dakota. And a little factoid is that Mary and I first met each other in the mid-90s when we served on a presidential commission, both appointed by President Bill Clinton, to look at patient protection and improve quality in healthcare. And many of the issues that we discussed on that commission are now part of the Affordable Care Act. So it's been a real delight for me to work again with Mary Wakefield, and I want to turn the podium over to her. Mary Wakefield. I was going to say, do you have to stand the whole time? I thought maybe you were the bad guy.
Well, special thanks to Madam Secretary for her remarks, and good afternoon to each of you who are joining us today. I'm really pleased to be able to facilitate part of today's discussion with some of the extraordinary champions of change that are with us. Their work, your work, and the other panelists' work is, I think, a reflection of what the Affordable Care Act is really all about. And that is, it's about improving access to affordable health care for all Americans. And you've helped us to message that to people across the country. We are, as the Secretary indicated, now 2 years this week into the Affordable Care Act. And through a lot of hard work, from local to national levels and many points in between, the Affordable Care Act, the law itself, is taking deep and firm root. It is in the process of changing America's conversation about health and health care. And the citizen champions on the first panel, and I'm sure on the second panel too, but on the first panel today are certainly some of our premier agents of some of this change. They have been engaging conversation and driving the efforts locally, at state levels, and regionally to help people better understand the attributes of this extremely important law. Their stories reflect that substantial work to make a real commitment in their communities across the country, and their leadership on behalf of the health of all Americans is laudable. And while the panelists each have much, much longer bios and resumes than I would be able to take the time to share with you, to maximize our opportunity, I'm just going to say a word about each one of them, and with apologies to each of you for having to do that. But it's most important for folks to have the chance to hear from you. So let me just introduce each of them to you. First, Dr. John Casey. He is currently the Chief Resident of Emergency Medicine at Doctors Hospital in Columbus, Ohio. And he participates on a number of local and regional and national committees. He's an expert resource to his patients, and he is also an expert to his peers on policy matters, including healthcare reform and access to quality care. Sarah Finger is the founder and executive director of the Wisconsin Alliance of Women's Health. The Alliance has been recognized as Wisconsin's healthcare reform leader for women. Having participated in an Affordable Care Act webinar just yesterday with Sarah, I can personally attest to her passion and her dynamism as it pertains to improving the health of the public. Catherine Jeter has been the State Health Insurance Assistance Program Regional Coordinator in Chattanooga, Tennessee for the past 10 years, and she is employed by the Southeast Tennessee Development District Area Agency on Aging and Disability. Throughout her career, Ms. Jeter has worked with faith-based organizations to provide education about health benefits and preventive services. Josephine Underwood with Better Healthcare in Champaign, Illinois, has collaborated with organizations throughout her state, sharing information about the Affordable Care Act with them, and especially information about the benefits of that law to consumers. Her work has included working alongside of the NAACP, the Illinois Black Chamber of Commerce, and the Progressive Action for the Common Good Quad Cities Healthcare Task Force. Carmen Morales Board is a surgery department, family nurse practitioner, and a certified diabetes educator at Kern Medical Center in Bakersfield, California. She's an active member in SEIU's Nurse Alliance, and she serves on its National Leadership Council. Well, with that, we'll begin the conversation with this first panel, and I'm going to join you right there if you don't mind, and we'll just share a mic. And John, fair warning, we'll start with you.
Okay.
Okay. And if we have time, not sure we will, but if we have time, if there's a thought, a comment, a question that anyone in the audience would like to share, if we've got time, we'll certainly try to do that. So, Dr. Casey, can you tell us a little bit about your background as chief resident of emergency medicine and how that experience has strengthened your commitment, what you've seen there in that role that has really strengthened your commitment to educate others about the importance of the Affordable Care Act, both your colleagues and I think also consumers. So tell us a little bit about that, if you would.
Sure, happy to. So first, I'm honored to have been chosen. I think all of us were, as we were talking about earlier. So my education coming in, I'm an osteopathic emergency physician, and I do a lot of work with the American Osteopathic Association. And part of the joy of being an osteopathic physician is you're supposed to look at the whole patient, the whole healthcare system. You want to look at everything. And as an emergency room doctor, I take all comers, regardless of insurance status. But I know that when a patient is in my emergency department, a lot of times one of their big concerns is how am I going to be able to afford this? And am I going to be able to get the follow-up care that I need? So I've always been interested in policy, and certainly the ACA is right up there with guaranteeing access and guaranteeing that people can afford their health care. You asked me about, as far as emergency medicine goes, what I see. So we're kind of the bottom feeders of the hospital, and I say that in a nice way because we meander everywhere. And in my training, I go to every nook and cranny of the hospital. So I get to hear physicians from every walk talk about their interpretation of the ACA. And what I noticed was I like to refer to it as kind of duck sunbathing on a beach. A lot of them have passion, and their legs are just moving really, really fast because they really seem to care. But I tell them nothing's going to change until they put their feet in the water. And they don't put their feet in the water a lot. They don't like to engage. They're afraid that if they talk to the legislators, if they talk to their patients, if they talk about the Affordable Care Act, that they don't feel like they understand it enough and that they can speak confidently about it. So one of my goals is to make people feel comfortable talking about that, talking about it with each other, things that are great, things that could be improved, things that have made a difference, and then being able to talk to their patients about it, which is a huge part of the deal.
Yeah, compelling and frontline experience, it sounds like. Thank you for sharing that, and thank you for everything that you do.
Absolutely, thank you.
So, because we're a little bit tight with time, I'm going to go to Sarah Finger, sitting right next to me. As I mentioned, she's founder and executive director of the Wisconsin Alliance for Women's Health. And Sarah, you too, in a different way, have seen firsthand, I think, how the implementation of this law is positively affecting women in the state of Wisconsin. So I'd appreciate it if you could to give us one example or two examples of women that you've interacted with and how some provision or provisions of the law might be impacting their lives.
Again, thank you. This is an incredible honor, so thank you for having us. And it's nice to meet you after having a nice call with you yesterday. We at the Wisconsin Alliance for Women's Health have recognized that healthcare reform is one of the greatest women's health issues there is. Women have had to pay more out of pocket for healthcare, have had to be dependent on spouses, have been discriminated against because of our current healthcare system. And so for the last few years, working with Raising Women's Voices and the National Women's Law Center, we've been working to brings women's voices and needs to the table. And so my saying is, if you're not in the kitchen, you're on the menu. And so we, again, it's one of those things that people are intimidated by and maybe a little apathetic about the policy opportunities there are. But again, if we're not in the kitchen, we're on the menu. And so we're now seeing the opportunity to raise awareness of and appreciation for how Wisconsin women are winning with the Affordable Care Act, and we're now seeing, women take advantage of preventative health care services that have otherwise not been available or affordable for them. The idea of a lot of mothers, we heard the examples, a lot of mothers who have children with pre-existing conditions, to not have to worry about that, to not have to worry about lifetime caps. For young people, over 17,000 young people already in Wisconsin are having access to health care because they can stay on their parents' insurance to the age of 26. I have a friend on her 4th round of cancer, and it's beautiful to know that moving forward, she will not be discriminated against because of her challenges with cancer and will not hit those lifetime limits. So this is a huge win for us, and we continue to work to, again, raise awareness of and appreciation for what this offers to Wisconsin women and families.
Some really compelling examples. Thank you for sharing that.
Thank you.
So I'm going to turn over here and ask you, Catherine, if you can tell us about what prompted you to commit to work to reduce health disparities, because I think that's been a big part of what you've been focused on in the context of the Affordable Care Act. So tell us a little bit about that work and maybe what drew your attention to eliminating health disparities.
Certainly. Again, thank you so much for this honor. As the State Health Insurance Assistance Program, primarily the work that program and that I do with that program is helping Medicare beneficiaries understand their Medicare benefits. And in the area that I live in and work in, which is Chattanooga, Tennessee, one of the counties, which is Hamilton County, there is a zip code that is affected with the highest terms of chronic conditions, HIV/AIDS, heart disease, cancer. So when you look at a particular zip code like that in the area you live in, you become passionate, so to speak, to want to make a difference. And so I thought it was time to sort of get in the trenches and do something about it. There are a lot of organizations that are doing similar things as we're here being honored for, but there are a lot of vulnerable clients or individuals that are isolated from those services. So in terms of health disparities, we see a lot of individuals that are not necessarily getting access to the benefits that they need. So it was trying to be innovative in the ways that we can go out and reach those individuals to educate them. So it was coming up with ways to reach them and educate them about the Affordable Care Act.
So it sounds a little bit like you were saying enough is enough.
Yes.
Enough is enough.
Yes.
Yeah. Time for a change. Josephine, let me ask you the next question. So you've done a fair amount of work, needless to say, in fighting for health equity for populations over the past few decades. Could you tell us a little bit about how your experience as a community activist in particular and working with several nonprofit and advocacy organizations has really driven you to commit to improving and being an advocate for the health of individuals and using the Affordable Care Act as a vehicle to talk about both the need for improvement and this particular law being able to drive toward those improvements for the populations that you care deeply about?
Absolutely, and I echo the sentiments of everyone up here. This is an amazing honor to think that any group can come together and recognize 10 people out of hundreds and hundreds and hundreds of people that are doing such amazing work at the ground level of educating various populations is just mind-blowing and amazing to me. So, you know, one of the things, I come from social service background where we're doing direct services, whether it was mental health, physical health, behavioral health, families in crisis, and things like that. And it became an amazing wall to see families hit not being able to access services that they needed because of the type of insurance they had or because of lack of access or children not being able to go to school because they couldn't afford mental health prescriptions and physical health prescriptions and things like that. And it just became an aggravating situation for me to continue to observe and to continue to serve in that capacity. And so I started to look for avenues to really approach this challenge from a systematic point of view. And that really allowed me to work with a lot of different organizations. And what I find is that key in this concept is communicating with various communities. And we have organizations that have become experts at this that use language that most people in the average room don't understand. And so my passion has really become to make this an issue and a factor that's so understandable for people and relatable to people in their situations. We see all the time families that can't afford prescriptions, who mom is staying home and is missing days at work because she's sick, and how that impacts every aspect of life in different spheres. And really one of the key ways and one of the key avenues that's been afforded to me by working with different organizations is the ability to loop the issue of healthcare into various other issues. The issue of healthcare is an education issue. it's a health equity issue, it's an economics issue, and there's opportunities by thinking outside of just healthcare organizations that will allow us to have these conversations in scopes of looping them in with other issues. With the Supreme Court issues coming up, it will become again a national issue, but there are those influxes where this isn't the sexiest issue to talk about. And so finding those avenues where people are passionate about education and looping in why health equity is important in there is a key way to collaborate with organizations that do work beyond just the health issue as a focus.
Thank you. Helpful observation, and interesting because we've already heard about how an individual can work with other individuals and peers and patients, how an individual can lead an organization, how an individual can work in government and advance this agenda, and then also how an individual can work with multiple other organizations aligning this issue with other issues that are important to those organizations. So thank you. They're interesting highlights and contrasts. So Carmen, I think we'll go to you and talk a bit about how your work, if you would, with Cairn Medical Center has helped you to reach individuals and to help educate them about the characteristics of the Affordable Care Act. If you'd share a little bit about that with us, please.
Sure, and I thank you for this honor, and I am representing a whole team of nurses that has gone out to do this work. I'm just the one that got to come today. What we're doing is, they're right now in the hospital doing the work that I'm going to describe to you. What we found through the Nurse Alliance was that there was a way for us to start those conversations as nurses to our patients and to the rest of the community. And because Kern Medical Center is in the Central Valley, and we have a very high population of unemployment and low-wage jobs, and we have a lot of chronic diseases, even things that you probably don't hear about here in this part of the country, such as valley fever. We also have one of the highest rates of diabetes and obesity. So we're seeing a lot of people come into the emergency room for surgeries that they don't need, really could have avoided. And I'm a surgery pre-op nurse practitioner, so I'm actually pre-oping the patient for, usually an extremity or something being, many times due to the diabetes that they haven't been able to control, because they haven't been able to get their medicine. So we start the conversation with who needs information now. And we wear these buttons, and so we're reaching the patient at the time that they're in the hospital when they need that information, and it's gonna make that impact right then and there. There's the need. So if you're a young adult and you're in because you have chest pain and you didn't know that you could be on your parents' insurance because you're 24 years old and you're not in college and you don't have a job, we let you know that you can get on your parents' insurance and have access to care and don't need to be coming to the emergency room for chest pain. You will be able to see a primary doctor and get the medication you need. And with senior citizens, the same thing. They don't often realize that the medications that they're getting are, that donut hole is closing, and they can actually save money by switching to a different medication. We help them do that, and we start that conversation. So we've had classes at the hospital, and we've actually been to public health department and actually educated our public health nurses, who are going to be playing a huge role as the Affordable Care Act becomes a little more, more benefits become part of the law. The public health part of it is going to be extremely important, and so we feel like those nurses really needed to be informed, and now we have that joint conversation, and it's making a difference because I have people tell me, I thought that law was repealed, and we actually give them a little card that has all the information. It's real, and they say thank you, and they get insurance, and hopefully they won't be coming back to have an unnecessary surgery. So it's saving money.
That's a terrific strategy, and thank you for sharing that. Traditionally, of course, the role would be for you and for your colleagues to teach patients about their health. But in this case, you're also teaching them not only about their health, but also about the health benefits of the Affordable Care Act that they can take advantage of, and that then will hopefully mitigate other problems associated with the chronic illnesses that you were talking about just a minute ago. So thank you for that. Is there anything else that any one of the panelists would like to add in? I saw the next moderator come in the door, and I don't want to hold us up from letting him begin the second panel. But is there anything else that someone would have thought of that you wanted to add, that you might have thought or forgotten rather to say?
I did want to add one thing. one of the things that I see is that nonprofits are very afraid to talk about this as an issue related to voting, and as an issue related to educated voters. And I understand that nonprofits walk the fine line of not being able to endorse any candidates. However, in our educational outreach, what we can do is talk about where candidates fall regarding these key issues. And if this is an issue that is important to people, we can educate them about where running candidates fall regarding this issue, and make it pertinent to becoming a registered, educated, and voting voter. And I think that that will really help progress implementation, because then you have people voting based on issues that are important to them, that they are now educated about who the people in their community is and where they stand regarding this issue. That's very, very key that we make that connection.
Thanks, Josephine. Is there anything else that anyone would care to add? Okay. Well, with that, then, many, many thanks to each of you, both for being here with us today, for taking the time to share your observations and your stories, and mostly, deepest thanks to the work that each of you are doing in the communities that you hail from. Please join me in thanking them for being here today. With that, it's my pleasure. You can go ahead, and I'll be right behind you. But just to keep things moving, with that, it's my pleasure to turn over the reins of moderator to really a distinguished colleague, the Deputy White House Chief of Staff for Planning, Mark Childress. I saw him walk in a minute ago. There he is over there. Okay. Let me just say a word about Mark. Mark is someone who has really spent his career working to fashion policies to make high-quality health care available to everyone who needs it. He's served in leadership positions in both the public sector and the private sector, and he's worked at senior levels of government in the executive branch as well as in the U.S. Congress. His policy work has included working, for example, as former advisor to Senator Tom Daschle, Majority Leader. And Mark has also worked as senior counsel in the Clinton administration. He was general counsel on the Senate Health, Education, Labor, and Pensions Committee. And I'd invite you to please join me in welcoming Mark Childress to the stage.
I like how we have an operation where you have to bring your own name tag. So no one should get too full of themselves when you have to bring their own name tag with them. All right, so I'm going to actually, we didn't introduce you all before, right? Okay, good. I want to place the witness a little bit. So this is good because now you all brought your own name tags too. So, Joanne Fisher is a community activist. She is a nationally recognized leader advocating for women and children and families. You're the executive director of the Maternity Care Coalition, and I want to get this right. Your signature program, is it Mom Mobile? Okay, good, because it's M-O-M-able. So I figured it was Mom Mobile. Okay, good. And this has provided outreach and family support services to over 80,000 pregnant women and parents of infants. That's extraordinary. At 9 sites in Pennsylvania, including 1 at a women's correctional facility, right? Yeah. Jan, this is good, I'm learning. Okay, good, Jan, right? You're from Carson City, Nevada.
Yes, excellent.
I got that right. You're the co-founder of the Progressive Leadership Alliance of Nevada. You were a former school teacher, right?
Yeah.
You've been working on economic justice and environmental issues for nearly 30 years. So you started when you were 5.
Thank you.
Yeah.
Good job.
And you began working for the Nevada League of Women Voters, and you've been president of the Carson City chapter and state board member. So that's a great perspective. Alice, this is great. They actually gave me the piece of paper, and it's going down. We are a very impressive operation. Alice, you're the volunteer co-chair of the Affordable Care Public Education Committee for Kansas City, and you've coordinated over 35 presentations on the Affordable Care Act.
It's actually 72 now.
Okay. Someone is going to be fired.
We just increased it.
Yeah. So anyway, this is great because you definitely are in the trenches on working on the ACA. Adam, you're from my home state of North Carolina. I don't know if are you from North Carolina?
I am.
Okay, good.
Chapel Hill.
You paused there in a way. Adam is the director of the Health Access Coalition for the North Carolina Justice Center. That is one of North Carolina's leading voices for progressive health care reform, and it's particularly focuses on the needs of the uninsured and the underinsured. And during your tenure, you've fought, and particularly to keep health plans at nonprofit and community-focused institutions, and you've also worked on expansion of state Medicaid, right? And then Reverend Walling is from Cleveland, Ohio. Reverend Wallen is the executive director of the Faithful Reform in Healthcare, which is the largest interfaith coalition of national, state, and local organizations and individuals working for a healthcare future that embraces an inclusive, accessible, affordable, and accountable system of healthcare in the U.S. That is a heck of a thing to bite off. So well done. All right, let's just start with Joanne. And I know that this is a great sort of opportunity, and I wanted, in the context of your, really extraordinary program on maternal and child health, I wonder if you could talk a little bit about how the Affordable Care Act has already been beneficial to your work, and actually how, as it phases in, we can see it having more benefits. So.
Great, thank you, and thank you again for this honor and for including the particular issues of women and children around the Affordable Care Act. We learned early on that we couldn't serve families without doing advocacy, and we couldn't do advocacy and policy work without hearing the voices of families. And childbirth is such an extraordinary event in people's lives that the fact that pregnancy has been, up until the Affordable Care Act, a pre-existing condition has really made it so that families who didn't have insurance or found themselves without insurance had to start that journey into parenthood with extraordinary stress. So we want to say thank you on this anniversary for the Affordable Care Act that is no longer the case, that pregnancy is a pre-existing condition. And we are very eager, yes. And we are very eager for 2014 because at that time, states like mine, Pennsylvania does not require maternity care to be part of health insurance packages. So we've had to introduce legislation so that until we get to 2014, that we could ensure motherhood in Pennsylvania. Another aspect of the Affordable Care Act that people know not as much about really are the critical workplace protections for breastfeeding mothers. And we have helped publicize those benefits where employers are required to give breaks for women to be able to breastfeed. According to the Office of Women's Health, the major deterrent to women breastfeeding is going back to work quickly. So this is so critical. And in our community, we've helped workplaces by consulting with them become breastfeeding friendly. And we are now giving breastfeeding friendly business awards to those companies that are exemplary to really help the community understand how important this is as a basis of good health for generations to come.
Great, that's fantastic. Jan, just sort of the same sort of a question. I mean, you've had a lot of experience. I mean, what have been the areas that you've focused on as you've sort of worked on your education about the ACA with folks? And what's been, I guess another way to put it is, where do you think folks have been most receptive to the message about the ACA?
Well, thank you very much, and it's an honor to be here with all of these participants. I work in a coalition. PLAN is a broad-based coalition of 30-member groups. So I'm always bringing people along, and I try to stay in the background and let them come forward to talk about their work. And so we're mainly educating our members and their organizations. I often do presentations about advocacy to groups because of the human service world. They tend to want to just provide the service, and they don't tend to want to be advocates. And we have to work very hard to tell them they are the experts. We need them on the front line talking about what they're seeing in the community. I've been the lobbyist for Plan for the 18 years we've been operating, so I'm always bringing people to be in the front to talk about those issues. We see small businesses that have really struggled with healthcare. This is going to be tremendous for them. I'm very proud to say Nevada has moved forward with the Silver State Healthcare Exchange. It passed this last legislature. It's a miracle. Nevada tends to be last on a lot of indicators of well-being, but we are moving forward with the health exchange and ignoring the Supreme Court case, hoping to be on the front line to be able to provide health care for people when it is moving forward. So with that, and I think the pre-existing conditions is affecting a lot of people that are part of our group that can't access health care. One woman has gone back to school just part-time so she can access health care. She's, you know, there's a small businessman whose child was born with a condition that did not allow him to cover his child, and now he's going to be able to provide care for his child. So we're seeing it on a one-on-one. We've brought business people to Washington, D.C., and I have to say, two organizations that have really made a difference in Plan's work is Families USA and Healthcare for America Now, HCAN. They have educated us and moved us into the front line. And, you know, I would be remiss without saying it was my staff that should be getting this award, all of them, because they're all doing things on a daily basis to get the word out into the community. So thank you very much.
That's great. Thank you. So that's a good segue, Alice, with your 72 sessions. No.
And 1,202 people, or 1,200 people reached in 2 states and 4 counties in Missouri and Kansas.
Wow. So, you know, given that, it's interesting. I mean, you really are a great case study. I mean, what are the, when you're talking about the ACA, you know, what are the things that folks sort of naturally understand and kind of gravitate to really easily? And then what are the things that you found it's really difficult? Because the other panel talked a little bit about this too. Some of these things are really hard to kind of negotiate. So give us a sense of, you know, where you feel you've made the most progress and where you feel we have the most, you know, really to do.
Well, we're a small core group of retired people, and we are 2 social workers, a nurse, a teacher, and a researcher. And once we saw and knew about the final law in place, and we heard about it, we had decided to go out and reach as many people so that they would know what's in the law. The most frontline item we cover is preventive services, because that implements, that comes into effect and has been in effect. So we started there, and with the young adults in our state of Missouri, 38,000 have received health care, been eligible and signed on to health care, and at the federal level, many more. So we start with prevention and the parts of the law that have already been implemented, and we tell people to use the website, health.gov, and then through our national organizations, professional group network, NASW, the Society of Social Work Leadership in Healthcare, and our church groups and our neighborhood groups and all of those natural groups, we're on the bottom, we're bottoms up, and we go to grocery stores and we just can't help it, but we talk to people about what's out there. It's just natural, because if you've spent 30 years working to make sure that the uninsured get insured, and you have 50 million out there that don't have health insurance, you can't help but want to make sure they have that coverage and help them get on it, enroll, know the details, know how to navigate their plan, ask questions, say you're in for a wellness screening, make sure the staff knows what it's about, because often the staff in those offices don't know.
No, that's, you know, yes, that's good. And I think you've touched, you know, one of the things I think is so important is, you know, for those of us who live this, and it's such an important part of what we do every day, you know, we sort of take for granted that we have in our head exactly how the ACA is unfolding. And, you know, to us, it's, I mean, you know, we know that there are 2.5 million kids who are benefiting from that. We know that there's, you know, 54 million people in private insurance that get preventive health care. We know all this stuff. But the truth is, a lot of people in the world sort of, because the way this gets reported, it's kind of this great abstraction that's being fought out about what's going to happen, and and I think it really is incumbent upon those of us who really know and understand, because there's lots of people out there who are benefiting from the ACA that don't think they're benefiting from the ACA, and so if folks like us aren't going to be making that case, nobody's gonna. So I just think the fact that we know it so well can sometimes make us not understand. We should feel no problem about saying those stats every time we sit down with folks to talk about this bill, because it really is an enormous asset that it has. Adam, I wanted to, in addition to the work that you do sort of at this policy level, you are somebody who teach at the public health policy course at UNC, right? I mean, you're Chapel
correct.
Hill, right?
Yes.
Yeah. So I mean,
that's just one of the. That's in addition to everything else.
yes, in addition to everything else. So it's interesting when you're in a position of sort of trying to educate the next generation of people about these kinds of issues. How what's your perspective on that, and how do you feel about because this is a very sort of a signal change in this world, and as you're talking to students, kind of what's their perspective, what's your perspective?
Well, I hadn't thought about that question. I was focused on Alice's 72 meetings. I was a little worried.
It threw us all off.
Yeah.
Really, yeah.
I think the students really, they have a lot of the same perspective that the general public who we talk to in all our community meetings, not 72, but a lot, has. And I think what's interesting is I think and I find this sad, and I've heard this in talking with my fellow champions up here, is that I bet they've had exactly the same experience, that some of the misinformation that's out there makes it so that people don't take advantage of the parts of the Affordable Care Act that are already in place. And I think that is just the worst part of all this, because it's not, we're slowly implementing the whole thing, but there's lots of it, like the coverage for students, especially the coverage for people under age 26, whether they're in school or not, or in graduate school. And I think I read somewhere this past week that one of the plaintiffs in that lawsuit in the Supreme Court to get rid of the Affordable Care Act is, unfortunately, she's a small business person, and she just had to declare bankruptcy, and she has several $1,000s in medical bills. And that means that at those hospitals, we're all going to have to pay for those. And she still is saying, well, I don't want this Affordable Care Act. Well, that's hard for me to understand. I think it's hard for us to understand. But I would like to not be mad at her, but sit down with her like we've sat down with so many people and say, look, have you thought about the option of the high-risk pools in the state? Maybe that's something that we could help you with. Did you look at the tax credits for small businesses? And I think that mirrors a lot of the same things that I think all of us have, is that when we sit down with people, whether it's students or whether it's the public, and there's so much misinformation out there that even the people who can be helped right now don't take advantage of it. And that's one of the most rewarding things to me when we have someone like my friend Michael, who's from Apex, who's able to stay on his parents' plan because of the ACA's under 26, even though he has his chronic disease, or Carolyn in Asheville, who is another friend who's able to get on the high-risk pool, that the weight is off their shoulders, and I'd like the weight to be off everybody's shoulders, and I think we all would.
Yeah, well said, yeah. Reverend Walling, just maybe you could take a couple of minutes to talk to us about some of the unique challenges and opportunities in the faith world as you've talked to folks about the ACA.
I think I'd like to start with the opportunities.
Fair enough. If you want, you can skip the challenges.
I'll skip the challenges. I think the faith community offers an incredible positive environment in which we can begin talking about the Affordable Care Act. The 300 million people that call themselves Americans, most claim to be people of faith, even though they don't necessarily engage in the practice of institutional religion. But they claim to be people of faith, or at least people who consider themselves to be moral and to ground their living in moral principles. And the faith community is not the only bearer of morality, but if we don't lead the case for it, then we can't expect it elsewhere. And I think the faith community, one of the opportunities is that we already have educational structures in place that can be tapped into. We don't have to create a new wheel. We don't have to invent a new wheel to tap into the educational opportunities about the Affordable Care Act. And then our clergy are often on the front lines of medical crises with members of their congregations. And educated clergy can help people understand when they come in, I can't do this because I don't have the money. Are you aware of this, this, and this in the Affordable Care Act that opens access to health care to them? And so we have those opportunities to be together. And I think we have an opportunity to carry really two messages. One, that we have to move away from political debate to moral discourse. That all of our faith communities, I haven't come across one yet, that does not affirm that needed health care is something that everyone in this country should have. We disagree on how to get there, but we believe that that should be a fact of life, a right for who we are as an American people. And we also believe in planning for the common good, in doing things that contribute to the well-being of all of us. And through the years, that has been obvious in building our interstate highways, our clean water systems, our communication systems, our educational systems, that we sat down and said, what do we need to thrive? And we believe that it's time that healthcare become one of the infrastructure that is developed to contribute to the common good. That when people go, I brought myself up from my bootstraps, and that everybody should be able to do that. The faith community understands that not everybody has bootstraps. And the faith community also understands that all the people that seem to have done things on their own depended on all of those things that were part of the common good. And so those are the opportunities. The challenges lie in the fact that the faith community is probably the greatest representation of the diversity in our country. The same political diversity that exists in Congress exists in our faith communities. And so talking about something that has become a political hot potato is something sometimes difficult. But we can contribute to dialogue, that regardless of what our political ideologies are, we love the people that go to worship with us. We love spending time with them and going to dinners and weddings and all of those things. And if we can create places where we can dialogue together from the grassroots up, then we can make a difference.
That's great. Yeah. Do we have time for... I don't see anybody doing one of these, so I'm just... Yeah. Can I... okay. I want to actually hear from all of you because I'm interested because you each have a sort of unique perspective, and you all are great advocates and missionaries, as it were. If you, from your experience, were trying to talk to other folks, in other words, trying to get other people involved in this effort, what have you all learned that would be the thing that you would be most focused on as you were trying to get other people to kind of take on this mission, as it were? So.
Secretary Sebelius talked about this having been in this for quite a long time, and I too last time around had conversations and learned all the details of the act. I think what's different now is our ability to talk directly to people. My colleagues here from Healthy Mothers, Healthy Babies have put forth Text for Baby, where through that we can talk directly to families about the things that are most important to them. So how to sign up for CHIP, what are these provisions if you have a child with special health care needs? My colleagues here are tweeting and blast emailing, and so I think our capacity now to talk directly to people with their particular issues of concern is something that we never had before in such a big way. And I think that this time round, I think this is a real opportunity for us to talk much more directly to people rather than through other spokespeople.
That's great. Jan?
You know, in my advocacy work at the state legislature, I've seen one person really make a difference. A young man came to the legislature and he wanted to pass right to die legislation because his mother and his sister had had horrible, prolonged deaths. And so I walked him around. Nevada's a small legislature, and introduced him, and he did it. And I realized then that what I had to do was get more people to do things like that. They needed to talk about it, come, speak to the legislature, speak to their neighbors, the markets, because the voices out there need to be heard, and I think people tend to be so wrapped up in making their lives just, go on and struggling that they don't seem to want to speak out. I do agree with you, Joanne, and I've been the dinosaur of my group with tweeting and, all those things. And I am really getting better at it. In fact, I came and I was ready to tweet, and there's no access in this building. And they're waiting for me to do something. So, we have the ability to do that, and we're all learning it. And I think it does make a difference. Makes a huge difference. So
I think that's good.
In our small core group of 5 people, as I said before, we're volunteers. Most of us are retired or doing work off the job. We've reached many people in our 2-hour trainings, which we consider advanced training, with the lengthy PowerPoints. We've identified many people in those training sessions, the 72 that we've done, in different spots and different professions and trade groups and citizens groups and AAUWs and AARP groups. People who are very attentive and ask really good questions, and that's where you really increase your knowledge. We picked them out and put them into a core group of about 20 people. I just sent them an email saying, would you like to be a part of a Train the Trainer program so we can send you out? And if you say yes, come in, we'll meet with you, train you for the advanced training to be an ambassador, and we can call on you, and we expect you to do 6 to 8 in any given year, because we think it's going to be a long process. But there are large numbers of newly retired people who are very active in their communities, and we have filled that gap. And I've already gotten responses from those people. And there's no money involved. No money and no legal staff at all. We're all volunteers. And we have no bosses and no daily schedules.
Sign me up. This is good.
I will.
Alice, you had to mention the 72 meetings again. That's very impressive, actually. I think the new thing for us is bringing the voices of the people who are affected to as many folks as we can. And it's so exciting. We've been able to really use our video capability to bring those stories and make very professional little short vignettes, what everybody's doing, but then take those and get reporters and folks to cover the stories of these people, because that's really the most powerful thing. And in fact, I'm just so excited about this. I am a native North Carolinian, but I'm going to fly to Albuquerque, New Mexico this afternoon to talk with another group and bring them equipment to do exactly the same thing. We've been going all over the country, me and my colleague Adam Linker. So we want those stories to get out to everybody, and the video is a great way to do it.
I think I would be remiss to the many folks in the Faithful Reform Network with whom I work and without whom I would not be here today to receive this honor, to say that perhaps one of the greatest things we've learned is that we have to be able to listen. That as a nation, we have tended to demonize the people that disagree with us politically. And in the faith community, we have realized, we have to diffuse that. We have to listen to each other, because facts are trumped by worldviews. If somebody comes in predisposed to be angry at what you are saying, then there's nothing you can say of a factual nature that will change their minds. So we really have to be engaged in talking to each other, to listening to each other, and bringing resolution to our differences.
Yeah, I could not agree more. That's fantastic. I think that's a good point to end on. The one thing I wanted to say is, this is a sort of a personal matter. This area of public policy, and particularly the Affordable Care Act, I personally have spent an enormous amount of time on this. This is something that means an enormous amount to me, and nothing that all of the people, political hacks like me, have done to sort of get to this point would mean anything at all but for people like you all. And I just want to thank you so much, because, and I'm so glad to have an opportunity for, not that I'm like a particularly bad political hack. I just but look, events like this are fantastic, and thank you all so much. So thanks a lot.
Thank you.
Great.
Are we done?
We have to stay up here?
Oh.
You're not to leave mine.
Hold on.
We have to stay?
Should I take my thing?
Yeah, take
your name. No, we're fine. Well, good afternoon. I think everybody can do better than that. Good afternoon. Much better. Thank you. I'm Ann Widger. I'm the Director of External Affairs at the Department of Health and Human Services. So I work for Secretary Sebelius, who you heard from earlier today. And I just want to take a few minutes to extend my thanks to all of you, all of the champions, and all of you in the audience for your participation today. And really more importantly, for all of the work that you've been doing here in DC, if you're from here, but really across the country, because I know many of you, even if you're from here, the important work you do is the work you're doing across the country. I also want to thank some folks who have actually worked really hard in putting this event together. Karen Richardson, who's wandering in the back from White House Office of Public Engagement, and Kyle Learman, who's also wandering, as well as Tori Scarborough from my staff, who's been working hand in hand with Karen Richardson and some of the other members of my staff who have helped her along the way. So if you would all give them a round of applause for me, that would be great. Always important to thank the people who are working hard on this stuff. So we all, and I say we have all been on the front lines of health reform for 2+ years now, and I think the Secretary mentioned my good friend Becky in the back from the American Nurses Association, and I remember being here at the White House and having Becky on speed dial and working with us during the passage of health reform, and then all of the work you're all doing now during implementation, excuse me. We are all out there continuing to make the case that we are a stronger, more prosperous country when all Americans have access to quality, affordable health care, and we should all be very, very proud of that work. And I really don't need to tell you about the law's impact. You've been hearing about it all afternoon, but I'm going to do it anyway. You've heard that more than 2.5 million young people are getting coverage through their parents' health plans. Millions of seniors are avoiding high-cost prescription drugs, saving almost $600 on average each year on their medications now. Small businesses are getting tax breaks on their health care bills and are able to hire more employees. And those are only just small snapshots. There are people like all of you who are working tirelessly to educate folks about just those small pieces of information to make sure people know what is in this law that is helping people right now. And the more we educate people about the law, the more they'll be able to take advantage of these benefits, as you've heard from everybody today. One of the best ways to help educate people about the law, and I think folks are doing this every day here, is to help tell the story about how people are being helped. And I'm going to talk to you a little bit about a campaign that the Department of Health and Human Services launched just this week to celebrate this 2-year anniversary of the Affordable Care Act. It's called My Care. And we hope you'll all join by going to healthcare.gov. I'm going to say this a couple times. Healthcare.gov, it's right on the front page, or you can do healthcare.gov/mycare. You can also tweet and use the hashtag mycare. I'm just learning about hashtags myself, but those of you who tweet, you should tweet right now about it. So what we're doing is a series of videos that are telling people's stories. So this is the 3rd day in our week-long celebration of the 2-year anniversary of the Affordable Care Act, so we've released 3 videos so far. The first one was a woman, Helen, who saved money because of discounts in the donut hole. The second one was Vanessa, who now can get the care she needs without being subject to lifetime limits. And today, it was Stephen, who is now able to stay on his parents' health insurance to get the care he needs. So what we're trying to do is have people tell their stories and say, this is Helen care, this is Stephen care, this is Vanessa care, this is Ann care, and tweet about that and use this MyCare hashtag. So again, it's healthcare.gov/MyCare. And use that MyCare hashtag, and I'm going to encourage you all to do that. And for those of you who may not have been to healthcare.gov generally, I do this sometimes. Raise your hand if you've been on healthcare.gov. Okay, good. This is I'm preaching to the choir here. But those of you who are watching on the web stream, go to healthcare.gov. There's wonderful information, fact sheets, information about implementation timeline, and information if you're looking to find insurance, on how to find that if you're currently uninsured. So please do that. I know we have another speaker, and here he is. So again, I want to thank you all for being here today. I have the pleasure to introduce our final speaker, Mr. Michael Stratmanis, who is Deputy Assistant to the President and Counselor to Valerie Jarrett, and also a personal friend and mentor of mine. So thank you so much, Michael, for being here.
Aren't we proud of it? Hi, everybody. I just want to take a second, interrupt the program to hello. Congratulations. Congratulations. Thank you so much. Congratulations. Thank you. Congratulations. Hi, everyone. So I'm for what's standing between you getting the heck out of here. So I'm going to be brief. I have the best part, the best job of this whole day. I get a chance to give you a little bit detailed thank you on behalf of the President, on behalf of the First Lady, and on behalf of Valerie Jarrett, my boss, who's on the road with the President right now. But first, one of the great things about working here is that we have these awesome young professionals who are doing amazing work, really dedicating themselves to public service, working long hours, doing great work. So can we just say thank you to Ann and to Kyle and to Karen and John Carson, I know you met earlier today. They are making us so proud. They're making us so proud. So just congratulations to our champions for their leadership and the great work they're doing in their communities. This series is really important, and you know, you may have heard that we do this just about every single week on different topics. The reason why we do this and the reason why I love doing it is I've had the privilege of working for and knowing the President and the First Lady for a little over 20 years now. Since I talked my way into a job at a law firm as a paralegal in Chicago when I was a college student. And so one of the things I know, because I've seen it, is they really believe that the best ideas come from the community. And that the best way to make the right decisions in government is to listen to the community and to take ideas from those who are making it happen on the ground. And so to be able to turn this into an actual program and to recognize our champions of change, it's a thrill for me. And so at a time when so many people are cynical about government and so many people are cynical about how we're helping one another and being our brother's keeper and being our sister's keeper, it just feels good. You know, I love it when we celebrate the Super Bowl champions, and I love it when we celebrate the World Series champions, but let's just give one more applause to our champions here who are educating people about health care. One of the things that I know, and I've been taught this since I was old enough to hear somebody's voice, is that knowledge is power. And the ability to know what your rights are, the ability to know what your benefits are, and the ability to understand and get the information so that you can get the health care that you have a right to as a citizen of this country, it's a powerful thing. And it doesn't happen automatically. It doesn't happen by osmosis. It happens because individual citizens decide to get a little bit out of their comfort zone and step up and step into the breach and explain to people who are so trusted. They will trust you much more than they'll trust some political hack like me, some White House staffer like me. They're going to trust you so much more. And so you are really an inspiration to all of us who are dedicated to public service. You're an inspiration to the audience who are so dedicated to this work. I saw the hands raised for those who've been to healthcare.gov. That's really impressive. You all made Ann's day. She's going to go back to Secretary Sebelius and brag about you. You're going to be an inspiration to everyone who really wants to get out and help make a difference on this important issue. And so, millions of Americans have gained new access to affordable health coverage and care through this law, but if they don't know they have access to it and they don't know how to connect to it, they're not going to get it. So I want to close by saying just a warm thank you for everyone for taking time out of your lives and your communities and your worlds to just come here and conquer the stairs and join us for a little while today to celebrate something important. I want to thank our champions for being leaders in their communities and being leaders for all of us. And really, I just think if we do this, continue to do this work together with this spirit of community, we're going to make a huge difference in the lives of Americans who need it the most. Thank you so much, everyone. Congratulations.